Alliance with Albury, Wodonga Health and Murrumbidgee Local Health District. I'm Tracey Oakman from Director of Public Health from Murrumbidgee Local Health District. So in our local region, in the Albury region, we have 2 positive COVID cases who are isolating in our region and being cared for at this current point locally. And we also have a positive in our sewage testing this morning. So that's not a surprise with the 2 cases in our region, but it is a timely warning for everyone that we do have COVID positive people in our region and we need to be vigilant. If anyone has any symptoms at all of COVID, please get a test. The testing clinics are open throughout the week in both Albury and Wodonga, and it's really important that anyone who's slightly suspicious, don't blame hay fever. If you've got a runny nose, get tested just to make sure that you don't have COVID. We also have a number of cases or a number of different truck drivers who have driven through our region over the last few weeks that have been positive, and there's a couple of identified exposure sites that have been released to the media. So Reese Plumbing at Dellinger Road in Lavington on Monday the 13th at 11:22 to 2:30 p.m. And Summit Power in Fallon Street, Albury on the 13th as well of September for 11:22 to 2:28 p.m. as well. And also there was a BP in Lavington, an exposure on the 8th of September between 7:30 and 8 o'clock at night. So if people were at those venues, we encourage them to get a test and to isolate until that test comes back negative. So please, again, don't make sure you get tested with any symptoms at all. We're also have vaccination clinics open across both sides of the border, and testing clinics, of course, both sides of the border as well. So please book in, get your vaccine. I understand there's plenty of vaccine available at various places through the GPs, and as well as the health service testing vaccination clinics. And I think as of next week, pharmacies also will have a vaccine available. So please take the opportunity to get vaccinated while you can. It does take a few weeks for the vaccine to work, so we do need to get that into your arm as soon as possible. Thank you.
Skills first. Yeah.
Thanks everyone. I just want to thank Murrumbidgee Health for the work they've done so far in terms of the identification of COVID positive people in Albury and the contact tracing that they've undertaken. As Tracey indicated, there are a couple of COVID positive patients that are currently under care at the moment. One of those is being cared for in the community and is isolated, and Albury Wodonga Health is leading that care. The other patient has actually been admitted into Albury-based hospital, currently in ICU, and will be transferred to Melbourne later today, in accordance with the Victorian protocol and how we deal with COVID positive patients. At this stage, we're very confident in the processes that both Murrumbidgee and Albury Wodonga Health are undertaking in terms of contact tracing, obviously in Albury, but also in Wodonga and North East Victoria. Processes are well underway. For those exposure or for those areas in North East Victoria where there has been some contact with positive COVID truck drivers, we're pretty confident that that's fairly low risk. It's unlikely at this stage that any Victorian sites will be declared as exposure sites. The contact tracing that's been completed has identified fairly minimal contact, and the truck driver involved certainly was taking all the appropriate precautions in making sure himself and people that he interacted were fairly safe. So that's really positive news. Again, would reiterate Tracey's message about if you have symptoms, please get tested. Very much encourage people to get vaccinated. We did have, I think, a record day yesterday at our vaccination clinics, and obviously primarily based in Wodonga, and we did have a pop-up clinic here in Albury. We did over 1,000 vaccines yesterday, which is fantastic. So really encourage people to keep coming forward, getting tested if they have symptoms, as I say, and certainly get the vaccination. So really positive news on that front, and just want to make sure everyone is clear that the COVID positives are under control, we're managing well, and working very closely with the
The two cases, what are the ages of the two patients, and also were they vaccinated, particularly the one in ICU?
Look, I can't answer either of those questions at this stage. Was not sure of their vaccination status. As I say, the one in ICU will be transferred to Melbourne today. He's of middle age. The other community-based person, I'm not sure of their age at this stage.
And are they linked, or do we know how they've gotten the virus?
Look, not linked in any way, come from very different places. Again, probably Murrumbidgee would be a bit better placed to identify where they've come from in terms of the contact tracing. But certainly there was no contraction, of course, in Albury or Wodonga, though they had contracted the virus from other places.
Can you talk us through, I guess, the condition of the man in ICU?
Look, all I can tell you is he is in ICU, he's being cared for. I understand he's not on a ventilator at the moment, but he will be, as I say, per the normal Victorian protocol, now be transferred to Melbourne and cared for in Melbourne as a identified streaming hospital for COVID patients. They'll be Royal Melbourne. And
are you expecting any more positive cases to come out of that? I guess household contacts or anything like that?
Look, from our perspective, as I say, the jury's still out on that. We're still doing our contact tracing, particularly in Albury, and that's really being run by Murrumbidgee. We'll see what comes out of that process. Again, just reiterating Tracey's message. Very keen if people have been at any of those exposure sites that Tracey indicated in Albury, please get tested as soon as you can. If people have symptoms, obviously get tested. So we'll wait and see what that brings us over the next few days.
Was he initially identified in Mildura, the case that's been transferred here?
So the patient was being cared for in Mildura and was transferred back here yesterday, and we've then taken over care of that patient, and as I say, he's now being transferred to Melbourne.
The other positive case, that's isolating at home, can you just talk us through their symptoms? Are they obviously well enough to be isolating at home?
Again, I can't really go into specific symptoms. They're not isolating at home, they're actually isolating in some accommodation that's been provided to them. Again, obviously we're monitoring the condition of that patient. If they are required to be admitted, we'll certainly do that. At this stage, I think we're very comfortable that the patient is able to be cared for in the accommodation that's been provided.
Tracey, did you want to head in front of the mic and answer some questions from Murrumbidgee's perspective?
I think probably one thing to add, which I didn't say at the start, is the Albury Wodonga Public Health Unit and the Murrumbidgee My Public Health Unit are working really closely together and collaborating when we do our contact tracing. We make sure that each other is aware of venues in either state that anyone we may identify who has travelled interstate. We share that information so that we can both work together to the best outcome for our community.
How concerned are you about these cases?
Well, it certainly is a concern. It's maybe the start of it is a concern. It may be the start of a number of cases in our region. It doesn't take much to spread the Delta virus, and so while we are endeavouring to make contact with anyone that those cases have been in contact with, sometimes it's hard to be comprehensive with that. So we are working through that and re-interviewing the people or the cases, one case in particular, again to try and elicit more information. But it is difficult sometimes to for people's recall. They say forget what they've done, and people don't often notice who they've walked past. So it is possibly the start of a number of cases in our region.
I just got some questions for my colleagues in Wodonga. Where is the essential worker from, and what type of work will they do?
The essential worker is from this region. Oh, sorry, the truck drivers that we're driving through. Look, there has been a number of them from all over Victoria and New South Wales. I'm sorry, I don't have the exact locations for where they were from. And from time to time, as they drive through, and we have identified where they may have stopped, such as a BP one that I just described to you, we will communicate that material and that information to you as best we can.
Is there any other information for Wodonga and exposure sites there?
Sorry, I couldn't hear that.
Is there any other information, for Wodonga and the exposure sites there?
Look, there has been a media release put out by Murrumbidgee for some exposure sites for an essential worker that was in Wodonga and Young over a period of time, and so that media release has gone out. The Wodonga exposure was about 14 days ago. However, so people who would be symptomatic by now if they'd contracted that off them, and so the Young one is some time ago too, but within the 14 days. So. Those people where we've been able to identify contacts, we've let them know, and that's generally the general sites have gone on that media just so that if we have missed people, they can be alerted to it.
And because it was some time ago, are you expecting more exposure sites to come out? Or?
Not from that particular person, but if someone turns positive, of course, then we start again. And we start looking again at all sites. So after a risk assessment of that particular individual.
And it's not sure where they contracted COVID from?
Well, the essential worker travels lots and travels through Sydney and so forth often. So on the probability, it was somewhere like that, but I'm not 100% sure.
Some more Wodonga questions. Is there any concern for passengers on the train service that's now been listed as an exposure site, particularly on other locations on that route?
Yeah, look, there is a risk, of course, with passengers that were on the train that came into the area the case was on. We are trying to establish more detail about that so that we can promote the times of the train. But again, it's proven, the exact timing has proven a little bit tricky, so we'll work through that, and as soon as we're able to release that information, we'll provide that to you.
Tracey, we've just been told we're going into lockdown tonight from 6 p.m. for 7 days. Do you think that's the right decision?
Look, I think that it's sad for our community, but I think it's the safest thing from a public health point of view. I think with potential risks in our community, a lockdown is the safest thing to do. Until we can see if there was any cases come out of the current exposures.
So your advice to the community again,
Yeah, look, be sensible, but it is hay fever season, so I will warn you, I'll remind you that your symptoms this time may be COVID, not just your usual hay fever. So if you do have any symptoms, respiratory symptoms, please don't write them off. And saying I'm not really sick, it's usual, I have this every year. Don't do that. This year get tested to rule it out, just to make sure that you don't have COVID. Please, the testing clinics are easy. The drive-through in Albury is easy. They're all easy to get to and access. And so please, they're free. Just go and get tested to make sure that you don't have COVID and spread it to your loved ones.
The exposure sites that have been announced today, there were rumours floating around yesterday of certain exposure sites. Why did it take so long to announce those sites?
Yeah, look, I think there's always rumours, and we do have to be careful about that. Why we take some time to release information is because we like to have factual information released. We don't want to create panic, and we don't want to create a hardship for businesses that may not need that hardship if in fact their exposure site was 1 day instead of 4, for example, and the different things like that. So we try to be responsible in what we put out in the media in terms of exposure sites, and to check our facts first, which is why sometimes it takes time, because it also takes some time to confirm those facts by multiple phone calls back to and from the cases, trying to remember where and when they were in places. So it's often, I think, if you think back on what you did in the last week, and I asked you to the minute where you were in a particular shop, you would take some time to recall that information potentially. So you must have some empathy for the people that we interview who are trying to find that information as well.
And last time we spoke, you said it was only a matter of time before we got cases here. It's happened. Are you concerned about the situation?
Look, of course I am. I'm a public health professional, and we do know that a pandemic in our area, is something to be concerned about. So we want people to be safe, and the safest people can be is to have been vaccinated. It reduces, while it may not reduce you catching COVID, it does reduce significantly your risk of being hospitalised and put in intensive care and dying. So the vaccine is very effective in keeping you healthy. So please get vaccinated. It's our our way of staying healthy in the community and our only way at this point, apart from not coming in contact with a COVID case.
Is there any opportunities to expand our vaccination program? I know we've got the hub in Wodonga. People are a bit nervous or scared and don't want to move too much. Is there any extra that might go into that effort in the wake of this?
Look, I think you'll find that there is ample GP practices that have the vaccine, and as you know, the pharmacies are coming on board, plus the public system vaccination clinics as well. I think there is lots of vaccine available in the community overall, and while there may be the occasional targeting program for a particular group of people or people who might have difficulty getting to the vaccination clinics for a particular reason, general public, there is lots of vaccine around, so just book into a clinic.
Is there much contact with those businesses impacted as exposure sites and their processes to reopen safely?
Yeah, look, we generally and we endeavour desperately to try and make sure we've talked to every business before we do put it in the media as well. Businesses don't necessarily need to close down. They will do a clean. Depending on the risk that has occurred, they may only shut for a very short period of time while they clean their premises, and then they can reopen, provided they have enough staff to do that. So sometimes, of course, smaller businesses, potentially the whole staff are in quarantine or isolation because of an exposure, and therefore they may not reopen the business. But certainly long term, we don't shut businesses long term.
Within
Albury going into lockdown, should Wodonga go too?
Look, I think that's always a delicate balance, and that's up for the government authorities to assess that. I'm not part of that decision making. Certainly we haven't had undiagnosed transmission that we're aware of in Wodonga, but that I'm aware of. But that's a decision for the politicians.
There's a testing clinic in Wodonga, EQEX Centre. I'm not going to attempt to say it because I'll say it wrong, but there's only one lane operating that we've been told because they're short-staffed, and we've repeatedly been told that they're ready to ramp up testing at short notice. Why are there delays in Wodonga today for that testing?
Look, I'm not familiar. I'm not aware of that particular thing. That would be the drive-through clinic I think you're talking about. I'm sorry, I'm not aware of any delays with staffing in that, but I can reassure you 100% that the district, if they are currently short on staff, they will be looking for staff to man that centre. Absolutely 100%, because they're committed to having ample testing available. There is also another testing clinic at the Murray Street Testing Clinic, public clinic, so that we do have a couple of sites in Wodonga. So I'm sure that they will be endeavouring to get staff to man that clinic as soon as possible.
And are you expecting more exposure sites and more positive cases to come out of the ones already announced?
Difficult to see, to know. I mean, it's probably likely, but you just don't know.
Just on the testing clinics, we visited some around here today and they were empty, barely any cars or barely any people waiting. I guess COVID fatigue might be setting in. What's your message to people?
Look, I think that your media today and tonight will probably prompt a lot more people to come to testing, and that's why we do this. This is why we try and get the message out to the public to make them aware to test. So thank you for coming and sharing that information with the public, because that's what we need to do. We need to make people realise that there is risks in the community, and the best way to prevent ongoing spread is to make sure that every person who is positive is in isolation and knows about their illness. So you guys will help support that. Thank you.
No, it's not your jurisdiction, but there's a couple of exposure sites nearby in Beechworth. Is there collaboration between health departments within Albury Wodonga Health or yourself to keep on top of any cases in the immediate region as well?
Well, as I said, we do have a collaboration, but I will hand over to Michael for that, because that's in his area.
Yes, so absolutely. There's certainly been a whole number of restaurants right across northeast Victoria that have had a visit from a particular truck driver who was COVID positive. As I've mentioned before, we are not likely to declare any exposure sites. The sites in Beechworth are not actually formal exposure sites. All that's happened there is businesses have been contacted to let them know that they've had a visit from a person, and as per the normal protocol, businesses are then asked to contact staff and others to get tested if they have any symptoms. We've done obviously some really detailed contact tracing with all those sites. As I mentioned before, we don't think the exposure risk is significant. In fact, we think it's low, and as I say, it's unlikely that we'll formally declare them as exposure sites. Those people that have been in contact with the particular driver have been directly contacted, and we're dealing with them in terms of getting appropriate testing, etc. And certainly there's been no further identified positive COVID cases from any of the East Victoria contacts.
Do you have thoughts on whether Wodonga or the rest of the North East should go back into lockdown with Albury?
Look, again, as Tracey said, it's always challenging, isn't it, the nature of the kind of community we have. It is going to be a decision for obviously government to make, and obviously we just need to manage that as it comes. Again, it would be unfortunate and challenging, and everybody in the border community knows the difficulties that we face, which are somewhat unique to this part of the world. But we'll see how that transpires over the next few days.